Hello, in this video, I'm going to talk about end-stage renal disease and exercise recommendations. So what is end-stage renal disease? As the kidneys lose function, chronic kidney disease moves through 5 stages. Stage 1 being the best, progressing eventually to stage 5, which is synonymous with end-stage renal disease. So at that point, glomerular filtration rate, or GFR, drops below 15. So that's 15% and 15 milliliters per minute. So risk factors for end-stage renal disease are diabetes mellitus, hypertension, hypercholesterolemia, and other inflammatory diseases. It makes sense if you think about the role of the kidneys, of course, is to filter out things in the blood that we want to excrete through the urine. So in diabetes mellitus, we have an accumulation of glucose because that glucose isn't going where it's supposed to go because of the condition. So all of that excess glucose is being filtered by the kidneys, and it's very hard on the kidneys. So diabetes mellitus that continues on for an extended period of time, over time, does damage the glomeruli, the tiny little blood vessels in the kidneys that make up the nephrons, where the glomerular filtration is taking place. Hypertension, again, this makes sense. If there's an excessive amount of pressure of the blood against the blood vessel walls, again, if that's happening for a prolonged period of time, then that excessive pressure is going to damage those tiny little blood vessels that are being used to filter the blood in the kidneys. And then same goes for too much cholesterol in the blood and other inflammatory diseases that can cause inflammation of the glomeruli and other parts of the kidney. So signs and symptoms would be fatigue, shortness of breath, loss of appetite, restlessness, change in urination patterns, loss of muscle mass, reduced skeletal muscle blood flow, and declined endurance. So if the kidneys are not doing their job and they're not filtering all of the things out of the blood that they're supposed to, then there's an accumulation of those toxic substances in the blood, which interfere with all sorts of normal bodily processes that cause all of these different signs and symptoms. So treatment in general for someone who has reached stage 5 of chronic kidney disease, the options are dialysis or kidney transplant. So there are a couple different kinds of dialysis. There's hemodialysis, which is the most common option. And so the person would have 2 sites where the dialysis machines connect to, one where the blood goes out and another where the blood comes back in. So the blood goes out, is filtered and cleaned by the machine, and then the cleaned blood then comes back in. That would be done 3 or 4 times a week. It can cause certain complications like hypotension, cramping, bleeding, and even more fatigue. And it also is a real big time suck. They have to go 3 or 4 times a week, and it takes a very long time. So somebody who is on dialysis is spending a lot of time in getting their dialysis treatment. Peritoneal dialysis, it offers more freedom. They don't have to go to the treatment center and sit there for hours several times a week. So they get more freedom, but it also costs more. But only about 7% of dialysis patients receive this type. So they introduce a patient-specific dialysis fluid into the peritoneal cavity, and that goes through a permanently installed catheter, but they do detach it and take it out for sleep at night. And so that goes into the lower abdominal wall. And so complications there are essentially similar to hemodialysis, but also infection and hernias and peritonitis. And then kidney transplant may be necessary if there isn't hope of recovery, which at stage 5 it probably is necessary. So initially after the transplant, they'll have increased fatigue and muscle weakness. They'll be taking prednisone after that to help prevent rejection of the new organ. So the prednisone might delay adaptations to resistance training. And lower intensity and duration of exercise would be required during periods of rejection if the person is rejecting. But normally you don't have to completely stop exercise altogether. You would just lower the intensity and duration so it's more tolerable for the patient. So some more exercise guidelines. Flexibility, resistance, and cardiovascular exercise are all important. And weight management is important for transplant patients to improve recovery and to help prevent rejection of the organ. So when they start the exercise program, you want to start slowly and very gradually progress. With these patients, it's really important to prevent discouragement because it could be very discouraging if they're feeling like they have too much fatigue or body pain, muscle weakness. So it could feel very discouraging. So you want to be careful not to progress too much too fast, which would worsen their fatigue, worsen their muscle soreness, and probably be pretty discouraging, which would interfere with long-term compliance. Other barriers to compliance would be that you don't want to have exercise sessions on the days that they receive dialysis, which is usually 3 or 4 days a week. So you want to plan well and do exercise on non-dialysis days. You should anticipate that there may be hospitalizations and other setbacks due to the progress of their condition. The intensity of exercise should be guided by their rate of perceived exertion. So as opposed to like heart rate or other measures that we might use for other types of patients, you want to go by how difficult the exercise feels to them on any given day, which can be different from one day to another. You probably are not going to be able to do exercise testing with these patients. And you want to avoid the use of 1 rep max because that is too high of intensity. So the goal and benefits of exercise for stage 5 kidney disease, the goal is to increase activity gradually. So just overall activity, regardless of what type of activity that is. So the goal is to gradually increase and work up towards a regular exercise program as much as that's possible. And there's an enormous amount of variability from one individual to another in terms of psychologically what they're capable of or willing to do, and also in terms of the physiological effects and benefits that they'll receive from that exercise. So with regular exercise, functional capacity usually improves. So that's functional capacity, like being able to walk further distances or increasing VO2. And so increasing those functional capacities will also help prevent further decline in physical function that's caused by the disease. You'll also see improvements in lean muscle mass and strength with resistance training, and improvements in the ability to perform activities of daily living. And it can also ameliorate or prevent some of the symptoms from dialysis. So exercise recommendations, again, they should be operating based on rate of perceived exertion rather than other measures of intensity. So with cardiovascular exercise, you want to aim for 12 to 15 RPE in terms of the intensity, 3 to 5 days a week for cardio, and maybe up to 30 minutes. So maybe 20 to 30 minutes per session. And it could be all sorts of things: walking, cycling, swimming, all sorts of different modes of exercise. And then resistance training, 2 or 3 days a week, maybe around 10 reps, 1 to 3 sets of 8 to 10 exercises using any sort of resistance training that is accessible and comfortable for the patient. And then some flexibility training, which will help with blood circulation and reducing the muscle pain and stiffness that they might be experiencing. All right, that's all I have for you today. Thanks so much for watching.